Our health and social care editor, Victoria MacDonald, is here. Victoria, take us all through the details.
Well, I suppose the Department of Health and Social Care must have breathed a sigh of relief when a few hours ago the nurses failed to secure enough votes to continue with their strike action. And then comes this: the consultants will take industrial action. And it's being described by some health leaders as a double whammy, coming so soon after the junior doctors. Now, consultants have promised Christmas Day cover, so they will cover emergencies but not routine appointments. There have been 500,000 cancelled operations and appointments and outpatient appointments in what will be the 8th consecutive month of industrial action in the NHS. And this is really beginning to bite because of the fact it's impacting the waiting lists.
So what do the consultants really want?
Well, the consultants, like the junior doctors, are saying that they, in real terms, they have lost 35% of their pay. Now, unlike the junior doctors, they are not asking for that restoration. What they're asking for is a pay rise more in line with inflation. They also want changes to the independent review body, which they say the government keeps interfering in. They had been asking for changes to their pensions, but the government did that recently, so that's now off the table. Now, the Department of Health says that they gave them 4.5% last year. Now, it's not in line with inflation, but they did give them this. Health leaders are beside themselves, as I said. There are 6 weeks to try and get these two sides back round the table and to negotiate. And one health leader actually said if they don't, this is absolutely calamitous.
Victoria, thanks very much. Well, a short while ago, I spoke to Dr. Vishal Sharma, who's a consultant cardiologist and chairs the British Medical Association's Consultants Committee. I began by asking if he thought there was the same strength of feeling now as when consultants took action in 2012 and in the 70s.
Now consultants are incredibly angry about what's happened to their pay, about what's happened to working conditions, and this has been really reflected in the ballot results today.
And when you look at the fact that there'll be a cumulative effect, won't there, of 5 days of junior doctors' strikes, and then shortly afterwards your 48-hour walkout, do you think patients would have every right to feel upset, even betrayed?
You know, no consultant wants to strike, and it's still really down to the government that they can actually avert these strikes. So we hope that they will come back to us and we can actually have some meaningful conversations.
You say it's down to the government, but it's also down to you, isn't it? Because you're asking for a 35% pay rise, effectively, because you want restoration of pay, which you say has gone down 35%. That's a massive ask, isn't it? Would you compromise?
So our pay's fallen by 35%, but we've not been asking for 35% as a pay rise straight away or anything like that at all. All we've asked is for fairness. So we've asked for our pay not to be cut this year, and what we're calling for is reform of our pay review process, which has been broken by government. So the government have been interfering with the independent process that is meant to set our pay for years.
It's all quite nebulous, though, isn't it? I mean, do you accept that you will move, you will compromise? So you say it's all in the government's court. It's actually you as well can make this happen.
Well, so far, the government, all that they've offered us is yet another pay cut. And when we've had our pay cut every year since 2008, they've offered us another pay cut this year, and that was just not acceptable to our members. Really, this can't go on because we're losing staff, we're losing doctors. They're going to Australia, they're going to New Zealand, and going to Ireland, and we're being actively poached by these countries.
When you think about the fact that consultants have a starting salary of £88,000, on average, they earn in the NHS above £126,000. How much public sympathy do you think you'll have?
The starting salary of a consultant after many, many years of training works out about £42 an hour. And I think most of the population will think that's not unreasonable for a consultant. And in terms of the average salary, the government like to quote that, but that's not for normal hours. That's not for a standard 40-hour week. Most consultants are doing well in excess of that, including overnights, including on-calls, additional kind of overtime, lots of unpaid overtime. And so actually, you know, it's not really comparable to say that that salary is just for a standard working week.
So do you really need a double-digit pay rise to avoid people leaving to go to Australia, when nurses have settled for 5%, for example?
Consultants have had by far the worst pay erosion of any group. So the nurses have had their pay cut very significantly. Only today that they were still balloting for strike action. Now, I know they weren't successful, but they're still angry. And clearly from the results today, you can see that nurses are still absolutely angry about what's happened to their pay. But consultants' pay has fallen even more.
Would you consider emigrating if you don't get the pay rise you want?
I love the NHS, I love this country, I want to stay in this country. Most consultants do want to stay in this country and work for the NHS, but at the moment, unless things change, I do fear that people will leave.
So have you got any sense of the proportion of your members who would up sticks and leave to the other side of the world, potentially?
So if you look at the sort of the future consultants, our junior doctor cohorts, around 30 to 40% of people have threatened that they're looking to leave in the next year or two to actually go overseas. So we are seeing big numbers in our surveys that people are looking to leave. And as I say, it takes a long time to train consultants. And if we can't keep the ones we've got, then we can't actually build the workforce that we actually need.
Dr. Vishal Sharma, thank you very much. Well, now, the former Health Secretary, Matt Hancock, has said he is profoundly sorry for mistakes that meant the United Kingdom was not properly prepared for COVID-19. He told the COVID inquiry that he was told by officials that the UK would be one of the best-placed countries in the world at responding to a pandemic. That turned out to be wrong. Civil servants, he said, were focusing on things like where to bury the dead rather than how to stop people dying in the first place. Here's Victoria MacDonald again.
The former Health Secretary gave barely a glance as he rushed into the COVID inquiry this morning. If he had stopped to look, he would have seen himself shaking hands with Lorelei King's husband. And the photo next to it, Vincent Marzello's coffin, following his death from COVID-19 in a care home in March 2020.
It was just a photo op. I realized that on that day back in 2018. And then, less than 2 years later, my husband was dead because of what I perceive as his shortcomings.
More than 39,000 care home residents died with COVID in the first year of the pandemic in England alone. Homes that Mr. Hancock claimed to have thrown a protective ring around. Yet in his evidence today, he admitted basic data was missing as coronavirus swept these shores.
There was work ongoing to try to find out even the basics of the provision of social care. For instance, how many care homes are operating right now in the UK? That was a fact that we did not know.
Mr. Hancock was Health and Social Care Secretary from July 2018 to June 2021, when he had to resign after he breached social distancing guidance by kissing a colleague. This module of the inquiry only runs up to January 2020 and only deals with resilience and preparedness. As with other witnesses, Mr. Hancock said the planning was for a flu pandemic and that he'd been reassured that the UK was one of the best prepared countries and that this was backed by the World Health Organization.
When you were told, however, by your civil servants that the United Kingdom was well prepared,
Yes.
What did they say when you asked them, as you presumably did, well, in what way are we prepared?
The attitude, the doctrine of the UK was to plan for the consequences of a disaster. Can we buy enough body bags? Where are we going to bury the dead? And that was completely wrong. Of course, it's important to have that in case you fail to stop a pandemic, but central to pandemic planning needs to be how do you stop the disaster from happening in the first place.
And as we've heard at the inquiry before, Brexit also diverted planners and planning, except it had one unintended benefit.
The work done for a no-deal Brexit on supply chains for medicines was the difference between running out of medicines in the peak of the pandemic and not running out. We came extremely close, within hours of running out of medicines for intensive care during the pandemic. It wasn't widely reported at the time.
Like others who have gone before him in this first part of the public inquiry, Mr. Hancock apologised to relatives, but outside there was little sympathy for the man who had such a high-profile role during the pandemic.
I'm not ready for apologies. I'm here to learn the truth and for lessons to be learned.
Mr. Hancock will likely return to the inquiry later this year to answer more questions, this time on what decisions were being made during the pandemic.